Welcome back to another episode of ENC Health Watch. I'm Jeffrey Roberts, and we are talking all things heart health today. I'm joined now by Dr. Vrinda Vyas. She is a cardiologist at ECU Health. Thanks so much for joining us.
Thank you for having me today.
So let's talk, obviously, all things cardiology. What exactly is it?
So basically, cardiology involves anything to do with the heart. It's the science of the heart and cardiovascular system. So as a physician who is a cardiologist, I deal with heart health and health of the blood vessels, your blood pressure, your sugar control, your cholesterol numbers.
And I know you talked about you being a non-invasive cardiologist. What does that mean?
Exactly. So a non-invasive cardiologist is a cardiologist who basically focuses on cardiovascular disease prevention. So a greater part of my job is enabling my patients and giving them the knowledge to prevent cardiovascular diseases from occurring in the first place.
Yeah, definitely. We could use all that prevention ourselves. So, I mean, when is the perfect time to start getting those heart checkups? Is there a specific age range or date? Should you wait until you start, feeling weird or?
So cardiovascular diseases, like I said, a lot of them are preventable, but there is a huge component of, hereditary and genetic predisposition.
Right.
So it's very important to talk to your family members and see if your parents or grandparents or if your siblings have encountered heart disease. It's better to get checked out early than wait for symptoms to develop.
So if you did have someone in your family who maybe did have a cardiac event happen, are you at an even higher risk than somebody who didn't?
Exactly, yes. So while a lot of cardiovascular disease is preventable with good diet, good lifestyle, stress control measures, and exercising regularly,
right,
a lot of it is also based on your genetic predisposition. So definitely talk to your family members and siblings and find out if anyone has a history of heart attacks or strokes. And if they do, you're at a higher risk than maybe anyone else your age and gender.
I know we hear a lot about heart attacks, especially when it comes to, your heart health, but what exactly happens in the heart during a heart attack?
So think of your heart as a garden and you're watering it with a garden hose. If the garden hose is blocked, what happens? The plants in the garden will start to die. That is exactly what happens in a heart attack. The garden hose gets completely blocked, blocking blood supply to your heart, which is what leads to heart attacks.
What are some of the signs of you having a heart attack?
I'm glad you asked me that question because this is the $1 million question.
Right.
It's very important to recognize heart attack in a timely fashion. And, it's very important to identify those early symptoms. The most common symptom that people encounter is that of chest pain or chest pressure. So, a chest pressure, a chest squeezing sensation in the middle of your chest is the most common symptoms. However, male and females, like men and women, can present with different variety of symptoms, including sudden sweating, lightheadedness, dizziness. Some people may even present with left shoulder or left arm pain or jaw pain or pain radiating to your back.
Yeah.
So it's very important to be mindful of those different presentations as well. Some people can also have difficulty breathing. So if you were to experience any of these symptoms, this should raise alarm bells in your head and, get the help right away.
Mm-hmm. When should you call 911 though? Because those all sound like symptoms that we all just have just every day.
It's very important to see if something has changed. So a lot of people may have symptoms of chest pain, chest pressure, but if it's in the context of, hey, I feel my symptoms getting more frequent or longer lasting than before, or sudden acute, symptoms which have been worse than ever before, that is definitely an indication to call 911.
Yeah.
And honestly, it's never a wrong answer. If something feels off, you know your body better than any doctor ever would. So no one's ever going to be like, hey, why did you call 911? Call 911, better to be safe than sorry.
Yeah, definitely, especially when it comes to the heart, because that's a pretty important part of our body.
Exactly, yes.
So, when you are trying to prevent heart attacks from happening, how do you go about doing that though?
So a lot of let me answer your question in a long-winded way. So why do these blockages happen in the arteries which supply blood to the heart?
Right.
Remember we talked about the garden hose being blocked? Why is the garden hose blocked? Number 1, high cholesterol. Number 2, high blood pressure. Number 3, high sugars, diabetes. Number 4, family history, like we talked about. And 5th most important reason which causes blockages is smoking. So high blood pressure,
Right.
high cholesterol, high sugars, and smoking and family history. That is what causes cholesterol to build up in the arteries of your heart, causing that garden hose to be blocked. And that, when the garden hose ends up getting blocked, leads to heart attacks. So most importantly, you gotta make sure your your cholesterol numbers, your blood pressure, your sugars are adequately controlled. And that's how you prevent heart attacks. So getting regular checkups with your doctor, making sure you take in all your medications, sleeping well, keeping stress under control. All those things have also been shown to prevent. And most importantly, no smoking.
Right. That's definitely a big one there.
Exactly.
What are some of like the normal cholesterol readings that you would see? I mean, because I hear cholesterol a lot, and for me, I'm like, okay, well, what is that? What's normal? What's too high? What's too low?
I know a lot of online, there's a lot of talk about cholesterol. It's the buzzword of the times. So most importantly, as a cardiologist, I'm looking at bad cholesterol numbers. So I'm looking at a value called LDL, or low density lipoprotein. So that is the cholesterol which has been found to be notorious to get absorbed and accumulated in those blood vessels, leading to the garden hose being blocked, right? So we are looking at numbers of LDL, which is the bad cholesterol. And I, as a cardiologist, like to see numbers less than 100. If you're a diabetic, I would want your numbers to be less than 50, 55. So, and if you have other risk factors, like we talked about, high blood pressure or family history, we may want the numbers to be lower.
Right.
So 100 is the cutoff for regular healthy people. So I want your bad cholesterol to be 100 or lower.
We're going to sneak in a quick break. Stay with us. We'll be right back. So I want to talk about some of the testing that you do in regards to checking in with someone's heart. You hear a lot about EKGs and echocardiographs. What happens during those tests, and what are things that you're looking for?
Exactly. So, EKG is the test of the electrical activity in your heart muscle. So heart is a muscle just like any other muscle in your body. It has its own electrical system. It has its own plumbing system. So if the plumbing system is blocked, that's when we have heart attacks. EKGs helps us to look at the electrical system and may indicate if there is anything abnormal in the heart structure. We have other kind of heart tests that we do recommend to look for blockages in the heart. And in the right clinical scenario, those tests may involve something like a stress test. A stress test could be different kinds. Sometimes we make patients run on the treadmill, and then we take pictures of the heart before we make them run and after we make them run. And then we compare those pictures to see if there's any area of the heart which is not moving the way it should. And that is an indication that there may be a blockage in that area. So we have a wide variety, a wide spectrum of tests. We also have something called as ultrasound of your heart, also known as an echocardiogram, which helps us, how pregnant women get ultrasound of their bellies to look at the baby. We take pictures of your heart to look at your heart structure. So every test in cardiology has its own utility, but mostly to look for blockages, we do something called as the stress test. And like the name suggests, we stress your heart out.
Right.
And then we see what happens. And then we make sure that you don't have any underlying blockages, which may be 70, 80, 90% or more, and may require treatment. Now, if the question is what would be the treatment for a blockage, it can range anywhere from medications, which prevent the blockages from getting worse, to all the way to stents, wherein we go in and we put stents in the arteries and keep those arteries propped open, or pretty much keep that garden hose propped open so that it doesn't collapse and close.
When you say like blockages, what does that mean?
So blockages in the arteries is basically from the cholesterol. So again, it's the cholesterol buildup which is blocking those arteries. So it's the same thing. The garden hose being blocked or closed because of the cholesterol building up over a period of time.
And it could be like inside the heart, but also like just throughout the body too?
Exactly. So it could be in any of the arteries of your body. If it's in the arteries which supply blood to your heart, that's what causes heart attacks. If it's in the arteries which supply blood to your brain, that's what causes strokes. If it's in the arteries which supply blood to your legs, it can lead to amputations.
Right.
And the disease is called peripheral arterial disease. So your entire body gets blood through these pipes called arteries. And if those arteries are blocked as a result of cholesterol, high blood pressure, high sugar, the things we talked about before, and smoking being number one risk factor, that can lead to those pipes being blocked, which can lead to, like I said, heart attack, strokes, and peripheral vascular disease.
And silly question here, arteries are different than veins, right?
Yes. So veins and arteries, the way we distinguish them is basically arteries carry blood to your body or to your organs from the heart. So they carry oxygenated blood from your heart to the different organs of the body. And the veins carry blood which is deoxygenated from the organs back to the heart so that we can send it back to the lungs and get oxygen. Does that make sense?
Yeah, that's quite the trouble there.
We go through 13 to 15 years of schooling just to get it right.
Right.
So I know I'm giving you a lot of information today. Even if little bit of it sticks around, I think my job here would have been done. And the most important thing which I would probably want to communicate is smoking cessation. So smoking causes this process to occur at a very fast rate.
Right.
So, making sure you're taking your medications, making sure you're going to the doctor to get your cholesterol checked, making sure your diabetes and high blood pressure is under control. And most importantly, stopping smoking. So these things will definitely go the way to prevent heart disease from occurring.
You're also a volunteer with the American Heart Association, right?
Yes.
Talk about some of the work you do with them.
So most importantly for me, it's events wherein I can educate people. As a preventive cardiologist, part of my job is education. I believe knowledge is power. The more information I can give to my patients so that they can be armed with the tools to take care of themselves. So with AHA, mostly focusing on providing regular people with the information and the tools to take control of their own health. And that's what I help AHA with.
And they definitely also help you with, educating patients too, right?
Exactly. Their website is a phenomenal source. So I would, tell people to look at it all the time. They talk about how to decrease stress in your life. They talk about at least doing 150 minutes of exercise per week. So you can do maybe 30 minutes of walking for 5 days a week to meet your requirements. And AHA website also has tools and resources for CPR training, so hands-only CPR, so that not only can you identify symptoms and signs of heart attack, you can even treat people if you were to see a heart attack or a cardiac arrest out and about in your, at your school, at the shopping mall, and pretty much give someone the gift of life by saving their life by doing hands-only CPR.
They've got a lot of great resources there.
Exactly. And, people should definitely go to the American Heart Association website and educate themselves.
We're going to sneak in another quick break here. Stay with us. We'll be back. Welcome back to ENC Health Watch. We are continuing our conversation here with cardiologist Dr. Vyas. So I want to talk about blood pressure because we mentioned it a lot. Blood pressure is like super, super important. That's always the first thing they check when you go to the doctor. Why is blood pressure so important for your heart health?
Yes. So, we talked about heart attacks and blockages in the different arteries of your body. So for those blockages to happen, heart attack plays high blood pressure plays a crucial role. If you have high blood pressure, you're at a higher risk for having heart attacks and higher risk of having strokes. High blood pressure causes the arteries of your body to become thicker and basically puts a lot of pressure on your heart muscle to pump blood against the pipes being blocked and against this high blood pressure. That's why it's very important to keep blood pressure under control. Now, a common question that a lot of people ask us is, what is a normal blood pressure, right? So usually we recommend 120/80 or lower. A blood pressure recording has a high number and a lower number. The high number is basically the pressure with which your heart is pumping blood into the arteries, into the pipes. And the lower number is basically when the heart relaxes, what is the pressure in those pipes like? So whenever your blood pressure is 120/80 or higher, that is hypertension or high blood pressure.
Right.
And we have different grades based on how high it is. So, we have different treatment based on how high it is. Yeah.
How do you regulate it though? Like, how can you keep it to that manageable state?
So most importantly, in the early stages, this is what I was saying, we have different stages for high blood pressure. So in the early stages, if your blood pressure is just borderline, we recommend diet and lifestyle changes. So diet changes, there is something called as DASH diet or dietary approach to stop hypertension diet. Now, all these fancy words just to say that your diet should focus more on less salt consumption of whole grains, whole nuts, good healthy fats, and also incorporating good lifestyle changes. So, again, walking, getting your 7,000 steps, 10,000 steps a day if you can. So those changes will really help control your blood pressure if it's in the early stages. But if your blood pressure is so high that it's already in an advanced stage, you may need a medication or two, sometimes a combination pill, sometimes even more than 3 medications, right? So it's basically dependent on when you get diagnosed, what is your blood pressure level, at what stage of hypertension you are already at. Now, important thing about high blood pressure is it is a silent killer. And when I say silent killer, people may be walking around with extremely high blood pressure without any clinical signs and symptoms of high blood pressure. So it gets missed in a lot of people. And by the time we diagnose it, it's already a little too late and they have to be on 3 or 4 different kind of medications. And just dietary changes and lifestyle changes may not fix it. That's why it's very important to get it regularly checked. And that's why it's one of the first vitals they check at the doctor's visit, or if you go to a routine, like at a fair or things like that, because it's very important to pick up those patients who may have high blood pressure without having any symptoms of it.
Yeah, I know. Just in my own health journey, I was one of those people that didn't even know it because, you walk around, you feel normal and
exactly.
nothing
Yes.
feels different. But of course, it
Exactly.
is really important to sort of manage there. But I know you talked about some of those medications too, and just talk a little bit about like some of the different ones and how you can help that.
So, yes, everyone with high blood pressure should first of all get lifestyle changes. So, very important to keep your salt or sodium consumption under control.
That's the first thing.
Yes. When I say under control, maybe 1 bag of Lay's chips is going to exceed your sodium requirement for the day. So you know what I mean? It's so easy to go over French fries. We all love McDonald's every once in a while. That's my guilty pleasure food. I probably shouldn't say that on TV here. But, so being very mindful, reading food labels. So let's start with the lifestyle changes first. The easy to do, easier said than done.
Right.
But important to read those food labels to make sure the sodium or salt that you're eating is less than 1 to 2 grams a day. Okay? And then walking, exercising. Those are initial lifestyle changes we recommend to everyone with high blood pressure. But if you're being diagnosed with high blood pressure at an already advanced stage, wherein we do need to start you on medications, there are certain classes of medications which make you pee off excess fluid from your body, which also help to control your high blood pressure. We call it diuretics. There are certain medications, which help, especially for diabetic patients, which not only control diabetes and prevent heart attacks from that, they also help with high blood pressure control. So we have quite a few under our, in our instrument box, in our toolbox. And it just depends on what kind of patient we have. As a matter of fact, I think I should mention here, a lot of African American population, they're resistant to a lot of different medications that we use for high blood pressure. So our guidelines actually differ with what we should start for African Americans first, as opposed to the Caucasian population. And also there is a huge risk factor of genetic predisposition, or especially in the African American and the Latino community, and even for someone like me who's Indian or Southeast Asian population, we're we're more prone to developing high blood pressure and metabolic diseases.
We're going to sneak in one more quick break. Stay with us. Some of the other ways food can help with heart health.
Absolutely. While DASH diet has been proven to prevent high blood pressure because of its main focus on salt control, there are even better diets out there. And the most important one is called Mediterranean diet. That is the only diet which has been proven to prevent the blockages from occurring in your arteries of your heart in the first place.
I think another thing we all forget about too is just like managing your daily stress and also getting enough sleep too.
Exactly. So one of the major risk factors for cardiovascular disease is stress. And I'm glad we're having this conversation during the holiday time, because as much as this is the time of belonging and togetherness and joy,
Right.
it's also a pretty stressful time of the year.
Final thoughts?
I think we hit a lot of topics, different topics today.
We did.
One important thing I think is we see a lot of deadly heart attacks during the holiday period. Rather, research had shown that most number of people have deadly heart attacks on December 25th, followed by December 26th, and then January 1st.
Yeah.
So, excuse me. So like I said, this is a stressful part of the year because you're dealing with so much different family, different stress about shopping. And it's also important to not forget to take your medications, get your diet under control, and, stress under control. Try to remember to get those 6 to 8 hours of sleep at night. So just be careful during the holiday times to recognize the signs and symptoms of a heart attack in a timely fashion and get the help you need. A lot of people delay the help, even they have symptoms of their heart disease acting up.
Right.
They may not want to go to the hospital because of the holidays. So, as much as we want to spend this time with family, it's important to recognize that your health is at the forefront of it.
That does it for this episode of ENC Health Watch. I'm Jeffrey Roberts. We will see you right back here soon.